Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast.
KSJE is supported by San Juan Regional Medical Center. The caregivers of San Juan Regional Medical Center are committed to bettering the quality of life, health, and care of individuals, families, and our communities. Life is their sacred trust. Better is their mission. Here is their home. San Juan Regional Medical Center, improving the health of the Four Corners since 1910.
Ten minutes past 8 o'clock. It is Wednesday morning, the 20th day of August, 2025. Good morning, everyone. I'm Scott Michlin. Thank you for tuning in to KSJE 90.9 FM here in San Juan County, New Mexico. In Durango, Colorado, we broadcast at 103.3 FM. And if you're listening to my voice anywhere else on the planet, you've gone to our website to do that, ksje.com, or perhaps you're listening to me through the new KSJE app. A busy morning this morning. Here's what's coming up for you here on KSJE. We'll begin with our guest from San Juan Regional Medical Center talking about back-to-school health for kids who are heading back to school, vaccinations, school physicals, all those things coming up in the next few moments on KSJE. And then we'll be checking in about the Four Corners 9/11 Memorial Stair Climb event that is coming up in early September. So stay tuned for details about that today on KSJE. And we'll round out the hour this morning to talk about the Rule of Law program that is coming to Farmington, the New Mexico Supreme Court. Yes, you heard that right. The New Mexico Supreme Court coming to Farmington to hold a Rule of Law program here at San Juan College. That'll be happening next week. We'll share the details with you coming up this morning on KSJE. Next hour, of course, it's classical music with Mick Hess, Roving with the Arts. And then at 10:30, right on Four Corners, our local and regional author program with Delcherie Gladden. And she is talking about the book, The Perfect Family. That's coming up at 10:30 today. Don't forget, you can also connect with us on Blue Sky and X and Instagram, in addition to Facebook and YouTube. Check out KSJE Podcasts, and there it is, the KSJE app. You can download it now from the App Store and Google Play to stay connected on the go. Listen to the live stream, check out our podcasts, and much, much more, all part of the KSJE app on KSJE. Outside our studio, sunny 73 at the moment. We're expecting mostly sunny days today. The high 91 in Farmington, partly cloudy tonight, the low of 73. Sunny and hotter tomorrow, the high 95 on Thursday, partly sunny 93 on Friday. But let's take a look. Maybe a chance of some rain showers developing Friday night into Saturday, Sunday, Monday, and Tuesday. Wouldn't that be great? We'll see highs each day, 90 on Saturday, 83 on Sunday, and 85 on Monday, and maybe 80 on Tuesday, with about a 50% chance of showers the next several days. So we'll see if that storm system is as good as it looks like here on the forecast. So we will see what happens. But let me get to my guest who is here with me this morning. Jonathan Palmer is here from San Juan Health Partners Pediatrics. Thank you for coming in this morning. Always great to have you here. Welcome back.
Thank you, Scott. It's great to be back with you.
Very good. Thank you for being here. And we are talking about back-to-school health. You were seeing some students coming in for just physicals or checkups and things like that in the practice?
Oh, yeah. We're pretty inundated, getting them checked out, getting them qualified to play sports.
Right. That's part of this, right? So health, sports physicals are a big deal?
Yeah, we do a sports physical and mass physical thing with the high schools in May, but we can't get them all.
Right.
So a lot of them come in to get those done, and we really support the athletics program in our schools and community. We think it's great for our kids' mental health, for their physical health, and it really helps them academically because they make them keep their grades up, and we really like that.
Right, of course, very true. And when you're doing a sports physical, is there anything you're looking for, or just making sure everything is running properly, I guess, if they're going to go through some extra exertion on the practice field and things like that?
Right, yeah. One of the main things we're doing is a cardiovascular exam, heart and lungs, to make sure those are nice and strong and there's not any abnormalities. Really, it's not anything majorly comprehensive. But just a basic exam to make sure they're healthy enough to play,
Right.
and that they'll get healthier as they do so.
Right, very true. Another topic, too, is vaccinations. That's an important conversation as well. And so students need certain vaccinations to go to school and things like that, and they need to be updated from time to time. You're dealing with that, too?
Right, yeah, as we've talked about in the past, and most people know, the vaccines are incredibly important for infants. Our infants really need to be protected from diseases that are endemic in our area that we see, and even some of these vaccines that we give have been developed in this area. So unfortunately, we still see children and adults dying from those vaccine-preventable diseases. So a lot of them are given in those first 2 years. But then there's other vaccines, like at 4-year-olds, they get their measles booster, which is, I'm sure most of you have heard, we had a big scare with that this summer.
Right. There was an outbreak in the Texas area, right?
Yeah. And if
we
they
had
get
one case locally, I think.
one case locally, and then some exposures that had to be treated, and luckily all those children did okay.
Okay. And I guess, and let me stop you. I'm sorry to interrupt you, but the reason I guess that we didn't see more here was because of the higher vaccination rate in the local area. Is that what happened?
Luckily, even with some of the vaccine skepticism, we still have about a 95% vaccination rate for measles specifically, and that's enough to prevent the spread.
Got it.
It's really easy. They can get the vaccine at a year old, and then they get a booster around preschool time, 4 years old, which makes it about 97% effective that they will not get measles if exposed. If they do if they are exposed, it won't be near as severe. So luckily, our community does a good job with that. Unfortunately, others are not doing near as good of a job. And instead of meeting with healthcare providers, the scientists, they're meeting with Facebook people and Instagram people.
That doesn't sound good to me.
Influencers that aren't there to treat your children when something goes awry.
Right.
So we'd really appreciate a conversation. If people are skeptical or if they're concerned, that they just come in and chat with us about it, and we can help them understand why it's so important.
That's a really good piece of advice, I think, too, for anything. And I think for parents, if they're ever concerned about whatever a doctor is prescribing for their child, to have that conversation. I don't think any doctor would not want to have a conversation or spend at least a few minutes with a concerned parent to explain maybe why this course of treatment or a vaccine schedule is being proposed for their child, things like that.
Yeah, exactly. Like some of the things that some people forget about and then remember when it's time to go back to school and the school nurse says your child needs these vaccines are more the teen vaccines, like the meningococcal vaccine, the Tdap booster for tetanus, pertussis, and diphtheria. Ones that we sometimes forget about, but
Right.
They need to have those because they're in that risk group. Meningitis is incredibly horrible for people to get it. And the teens and young college-age students are the ones at risk. So a lot of times at this time of year, they're coming in to catch up on those vaccines, and we're explaining the importance of those.
Right, very true. And so again, those are really important, and for kids and teens and even adults to stay up to date on those vaccines. And we've seen the great work that it does for public health.
Definitely.
Worldwide, and so that's part of this. And just again, and I think just recently Texas had kind of declared the measles outbreak over because they hadn't had a new case in several days or weeks. So that's a good sign.
Yeah, definitely.
I would think so. That's important. Very good. Some other things that are going on with you and your other and the practice. You've got some other things. Nutrition, I guess, is also important, right? For talking to kids.
Definitely, that's something we're always talking about, especially with our athletes, but kids in general. We kind of cheat in the summer, maybe not as much supervision, a lot of junk food, a lot of sodas. And now we're trying to get back to a healthy diet, which we should always have. You know, we can cheat a little bit. That's okay. But we have visits every day for kids coming in passing out because they go to school and they don't eat or drink all day long. They come home ravaged and storm the cupboards to get the junk food. That's a quick, easy fix. But if we maintain that balanced diet where we're eating at least 3 meals a day and having high protein snacks in between and really staying hydrated, we can avoid a lot of these problems. And that balanced diet needs to include iron. That's something we talk about all the time. Kids getting their meats and beans and dark green veggies so that their iron levels are up and they're not passing out when they're doing sports or other things.
Right, important. And are things like multivitamins or things like that important for kids, or is it better to get that from actual food and their diet and things like that?
Yeah, you know, it always is better to get it in your diet. It's better absorbed that way. Mm-hmm. But a multivitamin is fine, especially one with iron. Lots of them do the gummies that don't have the iron because it'll literally rust.
Yeah, right.
But if they do a crunchy, Flintstone type vitamin, or as you get older, one that you can swallow. Those are beneficial, but we always shoot to do it with our diet.
Got you. The other thing, Chris, you're getting kids and adults and teachers back together in close contact and in classrooms and passing in the hallways, and you're going to get those just sicknesses and whatever illnesses back to school time. Is that also something that you're seeing at the office?
Oh, most definitely. We have a little break in the summer where things aren't spreading as much. Last year, it seemed to be the entire school year things were spreading around. And one of the great ways to prevent that is just hand washing. Wash our hands. Try not to touch your face all the time. Don't share drinks with your classmates. Things are going to spread. That's the nature of it.
Right.
And we need to bolster our immunity that way. But there's things we can do to help. We're kind of inundated with that right now, trying to catch up with all this school stuff. And now that the kids are back together, watching the spread of these colds and things. So just common sense things. Hydration, good diet, sleep is incredibly important. You know, our immune system does a lot of its work while we're asleep. So if kids are only sleeping 6 or 7 hours a night, their immune system is really struggling. So maybe they're some of the ones that go back to school and get sick immediately. Or parents think they drop their kids off at daycare, 2 minutes later they're sick.
Right.
But yeah, we can do some things to help mitigate those problems and then, you know, let it take a few days. Sometimes people want to come in right away when kids are sick. And we don't even know where the disease is going to go, where the illness is going to go. So taking a few days and doing those things they've been trained to do, like the hydration, the sleep, the natural remedies of flushing their noses out, using the cough drops, you know, safe things. Honey, local honey is really good.
Right.
For colds and coughs and allergies. So if we can do some of those things, we can buy a few days, if not a week. And if the kids are getting worse or continuing to progress in their illness, then we definitely want to see them to help out.
Got you. And that's an important piece of advice, too, I would think. I know, again, a lot of parents get concerned, understandably so, if a child is ill, especially an infant or a younger child and things like that, who maybe a younger kid can't tell you maybe what's wrong and things like that. And so they want to make sure that they're doing the right thing and making sure to get confirmation from their pediatrician or whomever. Yeah,
and those ones are always great. We're always happy to see babies right away when they can't tell us what's going on.
Right.
The school age kids, we can wait a little longer.
Right.
And let them kind of work it out with their own immune systems.
Right.
But yeah, we love getting those babies in to check them out. Parents can't really look in the ears or listen to the lungs, and that's what we're there for.
You can do that. That's very true. For older kids, though, that are sniffling and whatever, and maybe having just the common cold, I mean, again, you just have to kind of let it run its course. There are some medications that certainly can help, I guess, diminish some of the symptoms, but it's just got to run its course, does it not?
Exactly. That's what we're really trying to do, is help with the symptomology of the illness and not try to get rid of it. Right. Our bodies will do that. And then we look out for things like, are they 7 days in and now their ears are hurting, or is the cough progressing and now they have a fever that they didn't have? Those are the type of things we definitely want to see. But yeah, the older kids can try the honey lemon teas. They can do the cold remedies. Most of those are pretty safe, 12 and over. 12 and younger, a lot of them, the natural remedies are better. A little allergy medicine can help with all the mucus, doing the steamy showers, the saline in their nose. Those are all things that parents can do at home. And, you know, we have them come in, they tell us, oh, I know you're going to tell me to do the exact same thing you told me to do last time, but this time I waited 5 days.
Okay.
And I'm like, well, that's great. Now we can see if there's a problem that can be addressed from our side.
Right. Yeah. Right. So they learn a little bit, maybe.
Exactly.
And that kind of helps a little bit, too.
Yeah,
so,
working together.
Yeah, that's important. The other thing I wanted to ask you about, we talk about going back to school in the fall and things like that. That lets me think about flu and flu season. I know it's a bit early to talk about vaccines for flu, but they're coming, I'm sure. But that's also another thing to be prepared for, I guess, and to be watching for when those flu vaccines become available in a month or 2 or 3.
Yeah, it should be available about exactly in a month. And we really like to vaccinate into September, October, and into November. That way we get protection for about 6 months. We haven't seen any cases yet, but like you said, Scott, it's coming. And last year was pretty rough. We had a pretty rough flu season, and due to various issues, the vaccine uptake wasn't very good. That's one of the struggles we have, is that people are very reluctant to get the flu vaccine. One, because schools don't require it. People seem much more likely to get a vaccine if the school requires it.
Right.
School doesn't require the flu vaccine. They don't require HPV. They don't require COVID vaccines. But those can be tremendously helpful. The flu vaccine is not perfect, and I think that's what people misunderstand. They think if I get the vaccine, I'm not going to get the flu. You could still get the flu, but it'll be a much milder case. And really with the flu, we also have to think about us getting it. If I were to get the flu, I obviously could spread it to all my patients. But if someone in the community gets it and goes over to grandma's house and gives her the flu or gives their new baby a flu, they can't get the vaccine until they're 6 months old.
Right.
We got to think about public health as well. I mean, we tend to think about ourselves as individuals, but it's also good to think about public health and, practice some altruism.
Sure, right. And I guess the other side of that, too, is if grandma gets the flu, that could be much more dangerous, I guess, for someone who's a grandma.
Exactly, yeah.
I didn't want to say old, but yeah.
Much more severe. Oh, we have young grandmas.
That's true.
Much more severe disease in the elderly.
Right.
And we can help out, especially as we gather for Thanksgiving and Christmas when we're all indoors and it's cold, and those things spread around so much easier. So maybe if you're having a hard time deciding for yourself, do it for your family.
True, very true. Have we heard anything about the type of flu that's maybe going around? Anything from the Southern Hemisphere, I guess, is kind of what they look for, right? To build up the flu vaccine for the Northern Hemisphere. They kind
and
of
then
look and
things
see.
spread so easily nowadays.
True.
Through travel and things, so it quickly comes here. So they study that vaccine, the flu strains that are there, and then they try to make a vaccine that will cover those for the year.
Right.
Last year the match wasn't great, but hopefully this year it'll be much better.
Okay.
But you're still getting some good cross immunity with that.
Right. Very good. Just a few minutes remaining this morning. Jonathan Palmer, and any other advice for families and moms and dads who are sending their kids off to school and are coming home a little sniffly, or maybe their allergies are kicking in, or the asthma's a little bit tough with some of the smoke that we've had in the air and things like that?
Yeah, I would say, we love to get outside. It's so important to do that for our vitamin D and sunlight, and just for our mental health. But we also need to take caution, like with the fires that have been around with our asthmatics. The allergies can be treated relatively easy. We have an allergy clinic where we do special immunotherapy in our clinic, and some other clinics around town do that as well. That can be tremendously helpful for these kids that are struggling all year long. So just doing those things and coming in and chatting with your provider to get the right medications and the right interventions that you need. Another one, if I could end on it, Scott, is mental health. Mental health as we go back to school is a big issue. Some of our kids are pretty isolated in the summer and come back a little sad. And just being a good friend is so important. Being a good friend to the kids at school, making new friends, reaching out to those that are alone or downtrodden, and really doing the things that are going to help our mental health. And being on a screen all the time is not one of them. A little of that's okay, and we know that it's going to happen. Mm-hmm. The schools have instituted that no cell phone policy, which I think is tremendously helpful for mental health and for their academic studies. And they can spend some time on the phones after school. But we really want to take that seriously, because a lot of our kids, especially our middle school kids, struggle with that. A lot of it's development, and they need to just get through these times and have the support they need. But if they work on those things we talked about earlier, the hydration, the sleep, the food, the sports, and getting involved in the community, those kids seem to not struggle near as much. The ones that are isolated and not doing the rest of those things really do struggle. And it's a pretty easy fix. It doesn't always take medication, doesn't always take therapy, but those things can be very, very helpful.
Right.
But yeah, if they just live a healthy lifestyle, if we work towards that and don't work towards putting a Band-Aid on it with some medicine or something, when it's needed, it's there. But otherwise, we can really work on these things and prevent a lot of our issues. And that's what we really focus on in pediatrics, is prevention.
Right.
With our vaccines and our healthy lifestyle, preventing the diseases before they happen, and not graduating them out to be adults with a myriad of diseases that are going to happen because they didn't do their due diligence in living a healthy lifestyle as a child.
True, very true. And I know a lot of kids, a lot of teens think that they are invincible and things like that. And so, but getting those healthy habits while they're young, hopefully will continue on into their older years and give them that healthier lifestyle too, and so they won't have some of these other chronic health conditions that we see when folks get to middle age or even older, I guess is what I'm trying to say.
Exactly.
So that's important. And I think the other word that comes to mind is maybe moderation. That seems to come around all the time, and so all things maybe with moderation is probably the plan.
Yeah, exactly. I mean, we know the kids are going to eat the junk food. We do it as adults, but if we moderate, it can be okay.
Right.
I love to exercise, and part of the reason I do is because I can eat some of the things I want to eat and get away with it. So it really, that is so important, moderation in all things.
Very good. Jonathan Palmer, great to have you here. Thank you for coming in, family nurse practitioner from San Juan Health Partners Pediatrics. Thanks for being here.
Thank you, Scott.
You bet. Back with more in just a moment.
Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.